Yeah, so I'm Karen Davison. I'm a Ngarrindjeri and Narungga woman from South Australia. So I grew up on Moonta on Narungga country on the Yorke Peninsula there, majority of my life, and I moved to Adelaide on Kaurna country to study at university, which I've completed a bachelor's in sports, health and physical activity. So I'm the Tackling Indigenous Smoking Youth Project Officer here at AXA. So we have a Tackling Indigenous Smoking team, which covers youth, women, men, in service, workforce stuff. But yeah, specifically with youth, I go around to schools and community events running, whether it's an education booklet on tobacco, or whether it's outside, bringing those elements of physical activity and healthy lifestyle choices to try and, keep young fellas engaged. So I guess one of the big successes we had recently was doing a big road show from Port Lincoln all the way back down to Kadina, where we partnered up with the Aboriginal Basketball Academy, running ABA basketball clinics within the community in the first week of the school holidays, which was really good. So, we developed basketball activities that were tailored to kind of mimic the effects smoking has on your body.
Cool.
So that was a really good response from community members and their students or the youth that participated. And I think obviously as the smoking rate is huge within the Aboriginal communities, it's good obviously getting out to youth and starting them young and educating them so they can obviously be the next leaders in leading a smoke-free lifestyle and community.
Right.
Yeah, so my name's Joshua Reeson and my mob is the Yakamara from Inaminka in around Oodnadatta and Cooper Pedy. And so that's the married name, and our grandmother's maiden name is Parkers, and I work here at AXA in the sexual health team. Yeah, so again, it's at AXA in the sexual health team, and we deliver education, support to our member services, to the Aboriginal health workers regarding sexual health and bloodborne virus information, and also creating and providing new content and resourcing that the community members can utilise as well. But we have an annual 6-week screening here at AXA, which means that we have a 6-week STI and bloodborne virus screening blitz, in which we, the sexual health team, support the member services to do a lot of community engagement regarding sexual health messaging and also testing as well. Yeah, so some of the big successes is, I guess, launching activity or community engagement groups. So for instance in Pikawea, in times gone past, there's been a World Women's House there, and while I necessarily haven't had much to do with the women's aspect of community health, it's the rest of the team in the sexual health that have had huge community engagement with, at any one time they've had up to 60 to 80 women participate. And myself doing, I guess, the men's equivalent to that. While we haven't had as much men, because it's, I guess, harder or more taboo to engage with men regarding sexual health, we have had, up to 15 to 20 people turn up to men's groups to talk about, STIs and BBVs and have those talks and those engagements. Just that, it's a huge, I guess, huge privilege for myself to be working in Aboriginal health and to give back. I've lived in QPD for a very long time and moved to Adelaide for, to broaden my opportunities in Aboriginal health. And, I'm always thankful that I can go back there and give back, my expertise, my knowledge now to help the communities. So.
Cool.
So my name's Trent Wingard. I'm a proud Ngarrindjeri, Bowen-Dip Ngana man, originally from Murray Bridge, but live in Adelaide now. So, I work at the Aboriginal Health Council and have been here for about 9 years. So I've just started in a new role as a workforce coordinator, but previously been working with young fellas in schools and delivering education on the importance of having a healthy lifestyle and smoke-free. Yeah. So with the workforce, I've been in this position for about 9 months now. So it's working closely with our ARCHOs and sort of scoping out the current workforce and the future goals and needs, but also what barriers they face as well with retention of workforce, and career pathways is a big one I'm passionate about as well. So at the moment, we're currently in talks with the Department of Education about having a career pathways from school to university, or either school to doing your Aboriginal health certificate. So we're really passionate about that, but also with exciting times, we're looking to have some AXA Open Days, as well as bring the school kids in to have a play with our clinic and do bloods and do some health checks as well, to pretty much to see if they want to work in Aboriginal health as well.